Well, I've made it very clear that when I was talking about jobs and pay, particularly under Croke Park, I want to see the costs reduced by reducing things like absenteeism, which have a roll-on effect on both overtime and agency staff use. And I made the point during the week, and I make it again, that some grades of staff in some hospitals have an absenteeism rate of 3.3%, and the same grade in another hospital has 9.97%. This is not tolerable. And you'll also find that the places that have the worst absenteeism rate also have the greatest overruns and also have the longest number of waits on trolleys. So this is a management issue that has to be addressed and is going to be addressed.
Do you accept there were shortcomings in your presentation of this issue last week?
I have absolutely no problem in acknowledging that I failed to communicate to people, those in particular who were feared the most and ended up sitting outside government buildings overnight, sufficiently. And for that I am deeply sorry. I mean, I tried on the Friday, through your own television channel, to say that nobody would lose service. Tony O'Brien said it again on RTE News. It wasn't heard with all the din. So look, I mean, I don't want to repeat of that. I have always prided myself as a doctor in protecting the patient. That remains my goal, and all our health reform is focused on that, putting the patient front and middle everywhere within the service. And I've often said that no matter how eloquently delivered or elegantly designed any initiative is, it's worthless unless it improves the patient experience. I want to assure the public that the issue around the cost of consultant care in this country is going to be addressed, and it's going to be addressed right across the board, not just in the public sector but also in the private sector. I want to assure them that this is something that I have the full backing of the government on, and that we have to follow due process. However, we have been in Croke Park. It has not delivered the sort of progress we need. We've gone to the LRC. I believe as of today there's letters indicating vacillation on the point of one of the consultants' organisations. I'm giving a loud and clear message. This won't be tolerated, and we will expedite this matter, and I intend to discuss even further options with my cabinet colleagues and the Attorney General. But be assured of this. This issue is not going to go away. It has to be addressed. But I want to be fair to those consultants who are cooperating, who have delivered change on the ground, who have started coming in on Saturdays and Sundays. And as a consequence, we now discharge patients 7 days a week instead of like previously only 5 days a week. That initiative, along with other things in the clinical programme, saved us 63 million last year and will save us 90 million this year. So I don't want to be hurting the very consultants who are delivering for us, whilst the ones who aren't delivering get away scot-free. So you need a little bit more, something more subtle than just putting a cap, because that actually hits the guys and girls who are full-time employees in the public service who are doing the business for us.
So how soon?
Well, I have been taking them on, and I have to follow due process. I have to go through the IR machinery, but I'm making it very clear I'm losing patience big time with one particular organisation that doesn't seem to want to cooperate at the LRC, and we will go from the LRC to the Labour Court, that being the case. And I mean, if they don't show up at the LRC at the next designated meeting, then I have options that I will exercise.